start it now. And then all right, let's see. Okay. Hello everybody, sorry for the technical difficulties. This is Dr. Meza, cosmetic dentist. He's here to present today and give us a little bit of insight. We apologize for the cutout. I think it was a sound problem, but unsure. Go ahead, Dr. Meza. We apologize for that.
Not a problem. Not a problem. Thanks for inviting me again. And this is a really good effort, for us to try to make you understand what you want to do for the rest of your life. And I can give you my tip, my advice on how to actually find out if this is for you or what exactly you want to do. So basically, a little bit of my history can guide you through the process. I'm going to tell you, some things that I did, to become who I am today, and a lot of this, well, some of the stories along the way. Basically, I was born and raised in San Jose, Costa Rica. I was born in 1971, so I'm turning 50 this year. Really time really flies. But I was young at some point, believe it or not, and and I was sometimes even hesitant about what I wanted to do. Even though I come from a long line of dentistry or dentists in my family, I'm the fifth generation, so everybody has been a dentist, and I was highly inspired by my dad. I used to take a summer job with him when I was in elementary school and do a lot of dental stuff on the back end, and usually at the lab. But it got me really involved, and I started loving what I was seeing and what I was doing. So my dad thought that besides the basic education I was getting in Costa Rica, I needed to speak a language, a foreign language, and hopefully English. Back then, schools they didn't teach any foreign languages, so they sent me as an exchange student back in 87, 88 to Pittsburgh, PA. So that's where I learned to speak English, and then I got involved with the country. I'm sorry, with the culture, and that's why I got really involved with the U.S. So I wanted to study dentistry in Pitt University in Pittsburgh, and I did my research, but it was extremely expensive. There was no way I could afford, paying dentistry in the U.S. So I came back to Costa Rica and I applied for the University of Costa Rica, where my dad used to teach. So I got full scholarship then, so that made more sense to me. I graduated back in 1996, and before then, before I graduated, I had to support my family because I got married when I was in dental school. And my part-time job was being a tour guide because I knew how to speak English. There were a lot of Americans coming into Costa Rica, and I knew a lot about geography and history of Costa Rica, so that made me, perfect for the job. So as I was working, I saw so many Americans coming into the country, and most of them were elder. So I thought to myself, these guys might need a lot of dental work, and they would probably need, some teeth back, maybe look better, and they probably cannot afford it back in the U.S. So I was trying to launch my service when I graduated to the U.S., but it was basically impossible because the only sources available to do some marketing were television, radio, and newspapers, or written media. So in this case, I wasn't able to afford it. Um, Back in 2002, my brother, he graduated from software engineering or software programming, and he told me we can make a web page. Back then, internet was not as popular, and well, I said, let's give it a try. It doesn't cost much back then, but people, they were not searching so much on internet as we all do today. So we started launching the clinic, or the name of the brand that we created. Suddenly, my last name is Meza, so we created Meza Dental Care. It was simple. So we did our first web page, trying to attract people to our practice, but they were requesting a lot of cosmetical procedures, and I wasn't trained on cosmetic dentistry. Although, it attracted me, but I didn't know how to do cosmetic dentistry. So what I did, after the first few clients, I started saving, and I started doing some research where I could be trained on cosmetic dentistry. So then I found the American Academy of Cosmetic Dentistry, which is kind of the one of the biggest organizations worldwide that holds most of the people related to cosmetic dentistry. And there's a lot of people really highly interested on training you to become a better dentist and to become a cosmetic dentist as well. They also have an accreditation process. So, as you might know, cosmetic dentistry is not recognized as a specialty per se today, but there are sources or places where you can get really highly skilled on cosmetic dentistry and become one of them. So the first thing I did was went to the first meeting of the American Academy of Cosmetic Dentistry that I was able to go back in 2005, and I found out amazing things happening on the cosmetic dentistry field. The first lecture I went to was Dr. Bill Dorfman, which used to be the head dentist on Extreme Makeover Show. So he inspired me big time, and I approached the guy, and he was humble and nice enough to talk to me, inspire me into cosmetic dentistry. So I started seeing things that I never saw before. So a whole new world opened up in front of my eyes, and I was starting to see what this masters of cosmetic dentistry were doing for patients back then. So I said, I want to do that. On a lecture, you don't learn much. You hear a lot of stuff, but you cannot practice. You cannot actually get highly trained on a lecture. So they recommended several schools and several institutions to get trained in cosmetic dentistry. So their UCLA showed up. Back then, all my savings were trying to promote my knowledge. So I was investing on a lot of education back then. So I wrote to UCLA. They had a postgrad training, and they accepted me, and I came from Costa Rica, and there I was, training with the best on cosmetic dentistry. So that was a dream come true for a dentist, and I was really happy for what I was seeing. And after I finished my training, I understood and I saw that my work was so beautiful, predictable, and people, they were trusting me more because of my knowledge, and they saw the results. So it was a really good time for me because I started, growing on my practice on cosmetic dentistry, and there were a lot of people interested on doing their smile makeovers with us. So I've been seeing the growth of cosmetic dentistry ever since. Nowadays, there's a lot of digital cosmetic dentistry, and I'm going to show you some cases later. But first of all, as most of you, when you're trying to find out what you want to do for the rest of your life, so many questions arise. First of all, do I want to be a dentist, or what do I want to be? Do I want to be on the medical field? Am I able to see things that most of people cannot tolerate? Am I able to put my hands in somebody's mouth that is going to be bleeding, that is not going to smell good, that might have a bad attitude as well, but still I need to help them because that's what I'm there for. So if those things, are on your list, then you might be ready to go there. Even though I think we're never sure about what we're going to do until we get really into dental school. Pre-dental gives you, good understanding. And in some cases, you can see that people is attracted to become a dentist because of the earnings maybe. Now, money is important, but it's not everything in life. And if you're going to do something for money, you're in the wrong field. If you want to do dentistry to make money, that's not the right thought to me. You got to be there to help people, to enjoy what you're doing, to help people smile again, to make them chew again, to make them get rid of pain, make them get rid of gum disease, which is something that, as I said, most of people don't tolerate because it doesn't look good, it doesn't smell good, and you got to put your hands and be close to that person right there. So if those things are in your mind, you might be a good candidate. Now, even though I'm going to give you a tip at the very end, but even though it's totally acceptable to be hesitant at that moment. We're not going to be 100% sure until you get probably into dental school, on dental school, you start seeing really cool things that are going to drive you to different fields of dentistry, different areas. As we were talking before, there's a lot of people that want to be a general dentist because they get to do a lot of stuff, but sometimes they want to get better in certain procedures that they're attracted more to, so they want to get a specialty on a field of dentistry. So those things you'll learn along the dental school. As I said, I became a dentist because I was really attracted and inspired by what my dad, used to talk about, and I used to see him. So when I graduated when I went into dental school, it was really tough. You really have to focus on what you wanted to do, because you were giving up a lot of time with your friends. You're gonna go out at night, even during the weekend. You were so stressed and focused on learning and studying and putting up with a lot of stuff that you wanted to do, because you were really focused on becoming a dentist. And the load of credits was really, really high. So it's something that really demands your time and your concentration. You gotta actually give up with your family at some point. So back on my personal history of why I became a cosmetic dentist, I told you, well, I was a tour guide, and I started attracting people from the U.S. So I saw this guy, this guru on cosmetic dentistry, Dr. Dorfman, who inspired me a lot on what I do today. And then I started, searching for the American Academy of Cosmetic Dentistry. Then I went to UCLA, where I did a lot of investment to get my training on cosmetic dentistry. Then I knew I was ready to perform cosmetic dentistry, even though I wanted to keep on moving. So and proving myself that I could do things right. So ever since cosmetic dentistry is not considered a specialty today, the American Academy of Cosmetic Dentistry has its own accreditation process. So I was tempted to go forward, and that's what I did. So I became accredited back in 2015. It took me a long time, because it's cases, submissions, written test, oral test, things like that. And then at the end, I became a better dentist, and I feel that I can really handle most of the cosmetic cases that I'm presented into. So back in 2008, when the big financial crisis struck in the U.S., a lot of my patients, they didn't even have money to pay my services in Costa Rica. So I decided to go for something that was basically giving me a little bit more income, and was related to what I was doing. And this was implant dentistry, which was starting to get really in back then. So what I did, I went back to UCLA one more time, and then that's what makes me do what I do today. I place dental implants, so I'm a surgeon, and then I'm a cosmetic dentist because I restore those cases as well. So out of a necessity, I was attracted to do something that I never thought I was going to become. While I was in dental school. And something that was really cool and attracted me to be a better dentist, to perform the best that I could. And as I told you before, one of the best things and the best rewards I can get is seeing a patient smile after the work, and having them so happy because they can chew again. And you get so many Christmas postcards, thanking you for having them chew again and smile again in the pictures and things like that. So it's really, really nice. Basically, well, I'm getting kind of lost here with the story, but can we move on? Thank you. So this is what it says, where I combine both fields of expertise: implant dentistry and cosmetic dentistry. I enjoy it a lot, even though it's not always great. There might be cases you're not successful at. Of course, we're permitted to fail because we're human. On the field, on the medical field, those are not exact science. It's not like adding 1 + 1, it's going to be 2. No, you try to do your best according to a protocol, and it might not work for the patient. So you got to go back and review it and perform better or in another way to try to deliver the best for this patient. So those are the things that might not turn out so good, and obviously the patients are not going to feel so happy about the work you're doing. But if you honestly, put your best effort on what you're doing, and they will know it, and then you will see what actually the result is going to be like. They're going to be even more grateful at the end. So usually my typical day, as I was presenting at the beginning of, as I was there at the beginning of the presentation, I enjoy on my personal life. I enjoy my family a lot. So I try to spend time with my wife and my sons whenever they're around. So my typical day starts usually at 5 a.m. in the morning. I go to the gym, or I used to before the pandemic, go to the gym with my wife, and then we used to have breakfast and get ready to go to work. I was showing up at work at 9 a.m., and we usually have a meeting to plan the day and see what we were going to do. And after then, the different teams, because the practice has grown, to have several teams taking care of patients. We used to split, and everybody was going to take care of their own patients. At the very beginning, I used to take, my record was, prepping 3 full mouths in one day. But I was young. I was probably 30, something like that. So nowadays, I'm not able to do that. But I usually take care of the heaviest load of the work in the morning when I'm fresher and I have more energy to prep a full mouth, to take a big surgery, something like that. And all the follow-ups or deliveries or things like that, they're going to happen in the afternoon. Usually I like to work from 9 to 5 because that's when I have my window of concentration during the day and my energy lasts enough. Now after 5 p.m., if it's necessary, I can stay, but usually I'm not performing that well. So I rather, put up with that or give up with the patients after then. So most of our patients come from abroad. And along this story, well, we have one main facility in Costa Rica. That's the one that I developed, and we just recently developed a new one in Cancun, Mexico. So we're now on the side of the what's this? The managing side of the business or the practice. There could be so many opportunities for one to grow if that's what you want to do. Some of us, would like to basically focus on what we're doing and just perform the best that we want to do. That's totally fair. Some of us, might need to or might want to grow in different directions and make our practice grow, build up a brand, build up an image, make a TV show, anything like that. So everything's possible. It just got to be in your mind. You got to be focus on what you want to do and develop your dreams. They don't come that easy. They don't come that fast. You just got to be persistent and they will come along. So the first one is going to be graduating from dental school. Well, the first one is going to be getting into dental school. Once you get into dental school, you're gonna see so many cool things, and you're going to be getting lucky. We will do. But it's so demanding that at some point you might think about giving up, or you might think about, this is not for me, this is not possible, this is impossible because it's too much work that I need to do to become a dentist. It happens to everybody, and most of us have been hesitant, as I said it before. So it's just to be a matter of being persistent. Once you graduate, define yourself. What do you want to be? What's the field of expertise you sometimes we go after graduating in dental school, we go straight into a specialty. It might be a way, but I would probably recommend to practice for 1 to 2 years before going to try to determine where you want to go, because you might end up knowing that you don't like what you're going to go for. So it happened to me, at the beginning I wanted to be an orthodontist. Didn't happen. I want to become a maxillofacial surgeon. It didn't happen. At the end, those things, I was doing some research and seeing it closer, but it didn't attract me as much as I thought it was going to be. And later on, when I was moving on in life, I found out my true passion, and it was driven by a stimulus that wasn't created by myself. It was an external stimulus. the patients were requesting doing some cosmetic dentistry. So that's when it all created like this huge effect in myself, and I wanted to become a cosmetic dentist. So as I said, life is going to drive you through what you're going to be doing, probably. But focus on what you want to do, believe in your dreams, and try to pursue them by being persistent and work hard towards getting. In my case, I believe, well, I consider myself really blessed and fortunate, because when you come from a third world country, you might think I don't have a whole lot of opportunity. But, when I put my feet on the UCLA ground, I said, this is amazing, because I'm right now where most of the masters make their books about cosmetic dentistry and dentistry. All the main inventions come from this university, and I'm here and I'm going to learn from these guys. So I took the chance, and that's what's, it's making me do what I do nowadays. Also amazing things that have happened throughout my career, due to the exposure that I've had on internet on the first years. A lot of media was interested in exposing what I do and talking about what I was doing. So I was on Newsweek, I was on TV, on different news channels. I was on a show on Discovery, Travel and Living, and all those things keep on coming along. But I never lost my focus, and I wanted to be a better dentist, a better cosmetic dentist. So that's what I do today. I'm actually lowering down the load of work nowadays. Well, as we all get old, we lose a little bit of our senses. We see less, we hear less, we get tired a little bit, easier. So that's where the point where I'm at. I don't consider myself old, but I see my body's aging, so I got to take it easier now. So at this point, I'm taking care of less cases. There are always bigger cases. That's what I love to do, such as this one. So so you can get a little taste of what I do on a daily basis and what a cosmetic dentist does on a daily basis. It's transforming smiles. And this is totally fair. It might be vain for some, it might be superficial, but it might be something that might change somebody's life. Because people, as we always see them on the first appointment, we get a protocol of pictures to understand how they look like. In most cases, they're really shy. They don't even know how to smile, because they have been practicing a fake smile to cover their defects for a long time. So at the end, you don't even have to ask them to smile. They will just do it. So in this case, this is a very nice case where this beautiful lady came to me because she was unhappy because she had a gummy smile. So after doing all the set of pictures, I found out, obviously, there was a lot of gum showing. And this is something that happens because the bone, it might be a little bigger, and the position of the upper arch, it's a little bit more protruded than for most of people, along with the position of the muscles that hold the mouth and all those things. So for starters, the teeth, they looked small because they didn't have the right proportion. So we had to do, the first thing we did was, after the set of pictures, create a digital mock-up. Before, we used to do them by hand. We used to mock up the cases, wax in the cases, but today we do it digital, so that's a huge advantage. So we do the case, we mock it up, and then we see the blueprint of the work. That's how we want to finish the case, and this is what we're going to present to the patient. Obviously, they don't see it, as good as we can foresee it, because we work on this, and this is the first time the patient is probably ever going to see it. So once they see the digital mock-up, we transform it into we print it digitally as well, and we copy it so we can present it in the patient's mouth. And they will see like a preview of how their smile is going to look like, and then they will tell, well, I'm able to do it, I'm willing to do it, and I'm going to go for it. So in this case, what we did was, after the digital mock-up, we had to do a gum surgery, because we cannot put teeth right on top of gum. So we got to lengthen the teeth, make those teeth a little larger, and change their shape, their appearance. maybe you want to move into the next slide, please. Okay, now you can see it closer. Now it's the same mouth. On your left-hand side, you're going to see that there's a lot more gum than you see on the right-hand side. You see on the right-hand side much fuller, bigger tooth with a better shape and better proportion than what you see on the left side. All those things were planned, and they didn't happen overnight. So we first had to do this, the digital mock-up, the digital impression, and then we did a surgery on the gum where we shaved the gum, and that gum needs to heal for about 8 weeks. So we will know exactly where the gum is going to heal, because the soft tissue doesn't heal as predictable as hard tissue. So in this case, I did the shaving of the gum, and the patient had to wait about 8 weeks, a little bit over, just to have a stable gum. Once it was stable, I was able to prep some veneers, minimally invasive, because dentistry nowadays is about preserving most of the tooth structure as possible. So we don't want to shave tooth just for the fun of it. We don't want to extract teeth just for the fun of it. We want to preserve as much tooth structure as possible, because there's nothing better than that today. So what I did was shave or prep the tooth, as we call it, on a minimally invasive way. So I was able to deliver almost prepless veneers. That means, I'm gonna add something on top of the tooth to make it look better. That way, I was able to change the shape, size, proportion, color, and the main configuration of the smile. So now she's got a fuller smile, and she's totally loving it. So this is a case I just delivered before Christmas, and she was ready for the Christmas picture. So next slide. We always do the smile transformations, in most cases on natural teeth. But after implants, dental implants, which are artificial replacement for natural teeth that you lose, those are actually titanium fixtures that go into the jawbone. We can replace missing teeth or teeth that need to be extracted. On her case, you can see the face on the left-hand side. That's the before. And you can see the smile. You can see the shape of the mouth. She's kind of hiding, her smile. And obviously she was not happy about what she was seeing on the mirror. You could see on the facial expression as well. She had severe gum disease, and unfortunately that drives to lose the bone that supports the teeth. So in that case, we had to get rid of the teeth. That there was no other way. Unfortunately, sometimes teeth, we lose them to gum disease, and they're not even decayed. They haven't even hurt. So we got to extract them. So on her case, we had to go for full extractions, place 6 dental implants on the upper arch, 6 on the lowers, and she needed to wait for 6 months before those implants took and were fused into the bone. That is called the healing process. In the meantime, she's going to be wearing temporary teeth that are plain dentures, teeth that she needs to take in and out. Imagine, moving from having fixed teeth in your mouth that you can chew with, even if they don't look right, they're helping you to chew. And you suddenly move overnight to having dentures. They're not going to hold in your mouth. You're going to feel depressed. You're going to feel really bad. Your food's not going to taste the same. But you have the hope that you already had the implants and you can have better teeth later. So in this case, on the right-hand side, you can see the final set of teeth. And if we go back on the slide, we can see the face, the facial expression. It says a lot. You can see how she fixed her hair, how she was doing a different type of makeup, and how beautiful she looks with her new set of teeth. Not only because she can chew again, but also because she has brighter teeth, better proportion, and a way much better configuration all the way across. She has a broad smile, and she's actually extremely happy about it. Now, on her case, and the other case as well, those are patients that they're now starting to combine dentistry with vacations. So they get to enjoy Costa Rica. Maybe you heard Costa Rica. It's a great touristic spot, and then Cancun, Mexico as well. So that's what I'm doing nowadays. And actually, it's part of the business that I do, but it's something that actually helps me enjoy my life a little better, because I'm moving from one environment to the other, 1 month to the other, and I enjoy the life in San Jose, Costa Rica. I enjoy the life in Cancun. So I get a little bit of both, and I get my mindset, totally, distressed. I don't. I'm not always at the same spot, thinking the same way, running into the same traffic jam every night. So I move to the beach. I take it easy. I clear up. I go to my hometown, and things start all over again. And patients, they enjoy it a lot too. So those are the things that you can develop, in life after a few years when you have determined what you want to do, and exactly you have been working towards it. Um, if there's something that I can really tell you about what to do in order to find out what your true selection is going to be, if you think in this case you want to become a dentist or a physician, try to go and ask one of these professionals and do some shadowing for a couple of weeks, a couple of months. Go there just to see what they do, and maybe you will get in love, or maybe you will, have a second thought. So that's one of the ways to try to find out exactly what you want to do. Even when you're on dental school, you might be hesitant, remember, but you came a long way, and you love most of the stuff that you've seen. You don't have to you don't have to like it 100%. You have to be very close to like it all, but it doesn't mean you need to like it all. Like in my case, when I was studying, when I was a general dentist, I used to hate periodontics. I used to hate endodontics, the root canals. So those things I don't do anymore, and I just do what I like to do, and I was training what I like to do. So those are things that I didn't like the 100%, but they're over. So I now moved on into something I really like and I really enjoy every day. So I wake I mean, believe it or not, Mondays are really good days for me, because that's when I'm anxious to go to my facility, or to my clinic again, and try to find out what's coming next. What type of case is coming in today? Who am I going to make smile different? So all those things, I really love. Um, so just keep in your mind that you really have to make a really good selection about what you want to do in life, because it might be something you're going to be doing for the rest of your life. So it's better to love what you do, because that way you won't be waking up to go to work every day. You will be waking up to go have fun every day, and you will be getting paid for that, which is even better. And as I said before, don't focus on doing something that is going to bring you a lot of money, because money doesn't bring happiness. It helps you in a lot of ways, but it doesn't bring you happiness at the end. What brings you happiness and warms your heart is helping people, trying to deliver the best that you can, and make you feel comfortable and happy about what you do in life. I hope that can help you. And if you have any questions, or if you want to approach me at some point, my website is www.mezadentalcare.com, and my Instagram account is dr.meza, and you'll find me there. And if you have any questions, I'll be glad to answer them.
All right, awesome. We have some questions from Instagram and then also YouTube. So, someone asked, how has your Latino background shaped your academic career and professional experiences?
Can you repeat it again?
Yeah.
I'm hearing you.
How has your Latino background shaped your academic career and professional experiences?
Oh, that's a good question. Never thought of that, but it has it wasn't interfering with what I wanted to do. It has made me proud of what about my achievements. As I said before, coming from a third world country and getting into a huge market, which is the American market. So that's kind of how I can answer that question.
Okay, awesome. And then I guess you kind of went over this a little bit, but were you ever interested in another profession, or do you still ever consider being a part of another profession?
You know what? That's great, because when I was studying, and at some point things got really hard, and I said, "Is this gonna be for me or not?" I was having second thoughts, and I said, I might give it a try. So I started doing some research. I thought I wanted to be a manager or economist or something like that, but at the end I said, math is not for me. I want to become a dentist, so I'm gonna keep on going. Now, this is really important. Um, we're really good trained to be dentists or to work in the medical field. What they don't train us for is to be a manager of your own practice, a marketer, a PR, anything like that. So you are going to have to complement your knowledge and skills with different fields if you really want to be successful in what you do. Because you need to know how to manage your practice. You need to know how you market yourself, because out there there's going to be thousands of professionals that they're doing the same thing that you are doing. So how are you going to stand out from the rest so people can see you and can go to your practice and you can benefit them and get benefits from that? So those are the things that you need to actually understand later on as you move along, what you need to be complimented on.
Awesome. And then we have another question. What is your favorite procedure to do?
There's several, but well, doing surgery, it's nice. Um, it actually, it's interesting how you can make the body transform on its own, just guiding it, through the procedure that you're doing. And also veneers. Veneers is great because it's if you know what you're doing, it's simple, and you see a lot of great results. But at the end, call it um, smile makeovers. That's what I do every day, and that's what I really love to do.
Awesome. And then one more topic that maybe you can talk about a little bit is um, the dental profession is obviously a little bit taxing money wise. What would you say to students who are worried about paying for dental school and being in the dental career because of money?
Okay, that's really important because it doesn't happen easy, it doesn't happen cheap. So you got to focus because it ties along with the your expectation in life and what you really want to be doing. Because for most of us, we're gonna go for a loan to go into dental school. So you got to be really sure that you want to become a dentist. Otherwise, how are you going to pay for that loan? But it happens in business everywhere. I mean, you want to open up a store, you got to find some financial aid. Um, you want to purchase a car, you got to find some financial aid. At least a car. If you're spending on a car, if it's your working tool, it's a good source to ask for a loan. If it's your luxury car, it is not. So in this case, if you're studying, this is going to be your future. This is going to be what actually makes your living in the future. And if there's no other source or any other way to pay for your dental, then a good loan might be what you need, of course. And after knowing what you want to do and be sure that you're going to get there, I mean, that's going to be piece of cake.
Okay, awesome. And then the last question that we have is how are you able to manage family and your career, especially early on when you first started?
Sorry, I didn't hear you again.
Yeah, how were you able to manage family and everything like that in your career when you first started, especially?
Well, it was tough, well, let's call it family. My family, my mom, dad, my brother and sister. Um, it was not as difficult to maybe move along and keep them aside because they knew it was my dream. Um, that's what I wanted to become, and they understood. They actually helped me understand what I wanted to do, and they were encouraging me to move on. Now, the other part, when I got married and I had my wife and two young kids, that was a little tougher because I wanted to be with them, you know, most of the time, but I wasn't able to. And I knew that I needed to become a better me to support them in life. And it was really tough at the beginning, But things started accommodating, and later on in life, it's just part of your routine. And then later on in life as well, you're gonna have more time to enjoy with your family. So there's a little bit of sacrifice in this, and just like everything in life, I mean, you gotta give up on something to have some kind of result in most cases. And in this case, it was a little bit of a sacrifice I had to do. But I'm happy I did it, because if I didn't do that, then my life was going to be totally different, and their lives were going to be different today as well.
Okay, awesome. And then, sorry, one more question is I know you mentioned that you had kids. Would you want them to be in the same profession as you or to venture out into anything they would want?
My kids, you said.
Yeah.
Okay. Uh, Basically, I just wanted them to be happy. I just wanted them to be whatever they wanted to be, but always keeping in mind that whatever they were doing was to make them happy and to help society, others, and make some living out of that. Now, at some point, I wanted them to be working with me, but this is how life goes. It's interesting because I said I come from a long line of dentists, and I'm the fifth generation, and well, I'm the last uh, in the family that preserves the last name Meza, being a dentist. The rest of them, my aunts and uncles, they had um, girls, so they don't preserve the last name. Besides, they weren't dentists, and the only two guys that were able to preserve the last name, being dentists, were my two kids, and none of them wanted to be. I did the same that my dad did with me. I brought him over to my practice during the summer. We love you, but we hate what you do. So good enough.
Yeah. Yeah.
Nowadays, interesting because because of that sacrifice that I did to become a dentist and to become a better me, and bring the support to my family, I was able to send them abroad to study. One went to Germany to become a communication designer, and the other one went to China, and he's a manager and business administrator. And we all gathered, and now we're developing a bigger company, which is Meza Dental Care International, because we have the guy that does the marketing and the guy that manages the practice. So at the end, I wanted him to be a dentist, and probably, we always think about what our kids we want them to be, because we think in a certain way, in a certain direction, but that might not be the right way to think for your kids. They got to make their own decisions, and at the end, it turned out good because we're all together again.
Yeah, that's awesome.
Yeah.
Okay, that concludes our questions. The post session quiz will be up in our bio on Instagram, and I'll try to link it in the chat. But other than that, thank you so much, Dr. Misa, for joining us today and presenting all about your profession. And it was really great to get to know you, and thank you so much.
My pleasure. It's been a pleasure, and thanks for inviting